Before viewing video lessons, it is important to read the textbook using the learning guide as your turn-by-turn directions. Then use the learning guide to take organized notes in your own words with examples and pictures.
This is a continuation of the video series on personality disorders in Chapter 11. In previous videos, we've discussed the categorical approach to personality disorders, and we have talked about the Cluster A disorders, and we have started the Cluster B disorders. We are going to pick up in Cluster B. So in a separate video, I discussed antisocial personality disorder in detail. In this video, we're going to pick up after antisocial. So antisocial was the pervasive disregard for and violation of the rights and safety of others. The disorders in this particular cluster are all characterized by dramatic, erratic, kind of emotional types of behaviors. And so for borderline personality disorder, you're going to see sort of the most erratic, up and down, dramatic moods of any of the disorders in Cluster B. People with borderline personality disorder have unstable moods, anger control problems, and impulsivity. And this is going to be in every area of their lives. It's going to be kind of constant. It's not going to be like a mood disorder where someone goes through a period of a mood disturbance and then returns to normal mood functioning. This is going to be chronically unstable moods. Now, their moods can swing from high to low to angry to irritable. They never seem to be on even keel when it comes to mood. This is going to be different from a mood disorder we will talk about at another point in the semester called bipolar disorder. People who have bipolar disorder will go through periods of sustained high mood, abnormal high mood, sustained low mood, and then also periods of normal mood. The abnormal mood periods for those individuals will last for days, weeks, months. Somebody with borderline personality disorder will have mood swings up and down in the middle of a given day. So somebody with a borderline personality disorder, you never know how they're going to be reacting emotionally, and you never know when it's going to change suddenly. People who are in a relationship with somebody who has borderline personality disorder will feel like they're on a roller coaster, that it's like up and down and over and up, and they never know which way is going. They can't predict how the person is going to feel about something. There's a series of books about living with somebody with personality disorder that uses the phrase walking on eggshells, because people feel like they have to kind of constantly be sensitive to the borderline personality disorder person's moods. People with this disorder also have extremely unstable relationships, which obviously stems from the mood, anger, and impulsive problems. But this is coupled with a fear of abandonment. And so if they feel like they're going to be abandoned by the other person, they will react in extreme dramatic ways. And so one of the concerns is suicidal gestures and suicidal attempts. So people will threaten to commit suicide if somebody tries to break up with them or leave. They may even attempt suicide in an effort to keep the person from leaving. And they are so fearful of being abandoned, they'll go to those great lengths. Histrionic personality disorder is a personality disorder we talked about previously because it is one of the ones that has some gender bias in diagnosis along with the antisocial personality. People with a histrionic personality disorder are very dramatic and sensational. They like to be the center of attention, so if nobody's paying attention to them, they'll do something very dramatic, sensational. Sexual provocation is oftentimes used to get attention and stay at the center of attention. and they may be somewhat impulsive. So this is the person that is always saying, look at me, 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 and acting in a way to sort of keep the attention and focus of the room on them. Narcissistic personality disorder is the final cluster B personality disorder. And with this personality, the person has a very exaggerated, unreasonable sense of self-importance. This is the person who thinks they're the center of the universe and everything revolves around them. Their ideas are the best ideas. They're somehow special and different from the rest of us. They're very arrogant. People with narcissistic personality disorder are highly sensitive to criticism. So if you try to point out an area where they maybe are wrong or incorrect about something, they're going to overreact to that. But they're very quick to criticize others and be insensitive to the needs of others. So these are the 4 cluster B personality disorders that have a shared dramatic, emotional, erratic factor, but that presents itself in slightly different ways in each of the 4 diagnoses. The last cluster or category are the cluster C, fearful and anxious cluster. So these disorders all share some kind of anxiety or fearfulness, but it manifests in different ways. So the first one is called avoidant personality disorder. People who have this personality disorder, it can sometimes look a little bit like a social phobia or a social anxiety disorder. They are very anxious about social relationships, very sensitive to evaluation by others. They're very fearful of being rejected. And so because they are so fearful that if they open themselves up to others and reach out to others that they'll be rejected, they just avoid them. So instead of sort of taking a risk and putting themselves out there, they will avoid at all costs any sort of intimate relationship with others. Dependent personality disorder, people have attachments, they have relationships with others, and they're very fearful, though, of being abandoned and rejected by those people. And the way that they deal with this fear and anxiety is with excessive clingy and submissive behavior. So this is the person who will do whatever you want and go wherever you want and please don't leave me, and is kind of clingy and needy. They have a very hard time making decisions on their own. So they're constantly wanting somebody else to be the ultimate decider of both major and minor decisions. This puts people with dependent personality disorder at risk for being in abusive relationships because they're going to be much less likely to leave that relationship if somebody is being overly controlling and even physically abusive. The final personality disorder is obsessive compulsive personality disorder. Now, it's really important to distinguish this from the anxiety-related disorders, the obsessive-compulsive disorders that are based on anxiety. So this is an obsessive-compulsive personality, and that means the person is extremely perfectionistic. Things have to be just so. They have to be a certain way, and that way is very orderly, very precise, and they spend a lot of time and energy focusing on this perfectionism and this orderliness to their lives. They tend to be somewhat emotionally shallow, so they have difficulty forming sort of true, close, intimate relationships with others. They tend to be a little bit standoffish interpersonally and present this image of perfection and orderliness. So what makes this distinctively different from the anxiety-based disorder is that while someone with obsessive compulsive personality has obsessive thoughts and obsesses about perfection and orderliness, they don't have the compulsive behaviors that characterize the anxiety disorder. And finally, I want to end the personality disorder coverage with a discussion of how we treat personality disorders. As was mentioned in earlier videos, personality disorders by definition are chronic and are very resistant to treatment. In addition, very few people with personality disorders seek treatment on their own. So they're more likely to present for treatment for some other disorder like depression or anxiety or substance use, maybe even marital therapy. And through the course of that treatment, the personality disorder is sometimes identified for treatment. So because personality disorders are most likely to also have some other diagnoses as well, the treatment will focus on treating that comorbid disorder, so treating the anxiety, the substance use, the depression, whatever that other problem is. But in terms of personality disorder treatment, most of these disorders have troubles with relationships and trusting others. And so treatment often focuses on how to build relationships and learn to trust. Also changing patterns of thought and behavior that are causing them disruption or dysfunction in their lives. It's very difficult to actually change the person's perspective, but you can focus on how, for selfish reasons or practical reasons, they shouldn't say those things or act that way because it's disruptive to their lives when other people are upset. It's very difficult to get them to see the other person's point of view. And so you kind of get them to behave in a way that is socially appropriate and also more functional because other people are more likely to respond to that. But we haven't found a way to really change their view of themselves and others. So very few people present for treatment, and even those who do present for treatment tend not to overcome or ever lose that personality disorder diagnosis. We have very few outcome studies, but generally speaking, the prognosis for this disorder is pretty poor.